Everyone has had their life impacted some way by the COVID-19 pandemic. However, the effects of this pandemic are not impacting everyone equally. The disproportionate impacts of the COVID-19 pandemic on different groups and individuals is an issue of social inequality, and one that demands action. Research and data have shown a common theme in the disproportionate hospitalizations and deaths following the COVID-19 pandemic. With a focus on race and ethnicity, income, and housing, we can see how the pandemic has caused certain people to be more impacted than others, depending on social factors. Racial inequality causes division in everyday life, and the pandemic is not an exception to this. As data indicates, people of color, primarily Black people, are overwhelmingly affected by the spread of the COVID-19 virus. In fact, the CDC reported that as of May 15, 2020, 40% of the national COVID-19 hospitalizations were non-Hispanic Black people, compared with 36.5% non-Hispanic white, 14.2% Hispanic, and 9.3% other. Although Black people only make up 13.4% of the U.S. population, they represent 40% of the COVID-19 related hospitalizations. This means that Black people are being hospitalized at a rate almost 3.1 times their population size. This can be understood through the concept of social vulnerability. The CDC defines social vulnerability as the resilience of communities when confronted by external stress on human health, stresses such as natural or human-caused disasters or disease outbreaks. As racism is the root of racial inequalities, it also shapes the vulnerability of communities. And these socially vulnerable communities and those living within them may not be able to respond to COVID-19 in a way that limits the spread and deathly impact of the virus. Infection rates and deaths also seem to be higher amongst the economically disadvantaged in society. This is due in part to their less favorable living conditions, but also the type of work they do. Frontline workers such as lower-paid healthcare workers, public transportation and delivery drivers are less likely to be able to socially distance and isolate themselves and therefore are higher risk of contracting the virus. Housing and living conditions is another factor in the disproportionate impacts of COVID-19. For example, in Brazilian cities, it is common to find houses with only a few rooms where the space is usually shared by several people. Crowded housing increases risk of exposure to infectious diseases and stress. The high-density population per room in Brazil means that about 6% of the population lives in households with 3 or more people per room, which makes it hard to comply with home quarantine measures and isolation. The relationship between social inequality and health has existed long before the COVID-19 pandemic hit. It is understood by sociologists that health is influenced by a number of social factors. These social determinants of health are relevant to the pandemic because the elderly, immunocompromised, and those with pre-existing conditions are more likely to become severely ill if infected with the virus. The pre-existing relationship between social inequality and health conditions means that the impact of social factors and inequality on someone's health pre-pandemic also heightens their risk of becoming seriously ill if they contract the virus. A study done in developing countries shows that the more socially and economically disadvantaged a person is, the more likely he or she is to suffer from high blood pressure, diabetes, and heart or respiratory diseases. They are also more likely to be exposed to infections due to their living conditions. This means that the socially and economically disadvantaged are more at risk when it comes to COVID-19 virus and being severely affected by it. Effects of COVID-19, however, are not limited to illness and death. There are also other impacts people are facing during this time that are not affecting people equally. For one, in addition to being at a higher risk for infection and mortality, older, marginalized populations are also more susceptible to economic, behavioral, and social impacts related to the efforts to contain the COVID-19 pandemic. The biggest defenses against the virus, self-isolation has become very common in the time since COVID-19 hit. However, once again, some people are feeling the impacts greater than others. For one, the minority populations, especially minority men, are more likely to be isolated and have small social networks. Their mental health is likely to be severely affected by the pandemic because they have less access to resources that help their mental health during crisis. This also highly impacts older adults who reside in residential care communities, as they will be at increased risk for social isolation and no social connections. In order to curb the disproportionate impacts of the COVID-19 pandemic, the policies put in place can't simply be addressed to everyone as equals because the pandemic is not affecting everyone equally. As research has shown, elderly people, minorities, low-income, and high-density households have proven to be more vulnerable to the impacts, and therefore policies should be directed at these groups of people. One of the easiest ways to do this is having resources offered to people in need. Having masks, hand sanitizer, and other necessities distributed to low-income families, homeless people, and other people in need would be beneficial. In order to keep it COVID-19 safe, drop-off boxes accepting donations could be stationed around the city and then collected to distribute after an isolation period to make sure the products are safe. As discussed, a low-income status can be connected to a greater risk of COVID-19 related impacts. With this reasoning, it would be beneficial to introduce financial aid targeted to help specifically people below the low-income cutoff line or low-income measure. An easier way to lessen the risk towards financially struggling people during this time would be to have the government compensate sick days for those without health benefits at their job. Low-income workers are put at risk because if they do get sick, they do not feel as though they can afford time off work. Compensating workers for the time they take off due to COVID-19 testing periods or contracting the virus would allow them and their coworkers to feel safer. As the year is coming to an end, there is hope of a vaccine soon becoming available to the population. In order to curb the inequalities that have existed throughout the pandemic, it is reasonable that a policy could be made to offer frontline workers the vaccine first. Research has shown that minorities are particularly susceptible due to the fact that they make up a large number of frontline workers, so the prioritization of frontline workers would benefit the minority population as well. The minority, along with the elderly population, have proven to be the most susceptible to both illness, death, and also other impacts of the virus. Therefore, by offering both frontline workers and elderly people the vaccine first, it'll help curb the unequal repercussions they faced. While social inequality has and will continue to exist before and after the COVID-19 pandemic. However, because this is such a complex issue, we can instead focus on what we can do to curb the disproportionate effects of COVID-19 right now. With the understanding of what groups are vulnerable and what is causing this, it allows us to determine what policies would be most beneficial to help.